All right, we're moving on to pin mode, which is different from gun mode in that you're not injecting anything into the skin. So pin mode is like microneedling with a single needle. You are making little micro channels in the skin, and then you can adjust the speed of the needling, but you aren't injecting fluid into the skin. And usually you're applying a topical serum or regenerative solution or something after you're doing that needling, right? Just like microneedling. So the settings for pin mode. So first of all, you want to push the button at the back that says pin. That's easy. When you do that, it will automatically change the press to 0, because in classic pin mode, you are not pressing on the syringe at all because you're not pushing any fluid into the skin, right? Now the other settings on pin mode are your depth, which again, same thing as gun mode, 0 to 10 millimeters. Frequency goes up to 1,500 strokes a minute on pin mode. It's going to go a lot faster on pin mode than it can on gun mode. Now there is something that I invented that's called dribble mode. Now in dribble mode, you're essentially using it as a pin, but you increase the press to like 5. So it's kind of dribbling a little bit of liquid on top of the skin as you go. This is akin to applying the liquid topically afterwards, but you're kind of doing it as you're going. Again, I call it dribble mode. It's not an official name. That's just me. All right, general rules for pin mode are similar to the general rules for gun mode. If you are using a deeper depth, you'll want to go with a lower frequency, a slower frequency. If you're using a high frequency, you'll want to move more slowly across the skin to avoid scratching the skin with those needles. You want to keep the vise perpendicular to the skin while you're needling. And you want to change your needle kit when you change body areas to keep the needles sharp and reduce pain. Again, unnecessary if you're just doing a small area here and there, but if you're doing a whole face and like a whole neck or a whole chest, this is not your chest, a whole scalp, then you'll want to change those needles. Now, hot tip, it is easiest to apply a topical gliding agent before using that microneedling or pin mode. Something like hyaluronic acid works really well. Alternatively, you can apply your active liquid like your peptide, your exosome solution, topically just a little bit to act as a glide before you do the needling. And then you can, of course, apply it afterwards as well. So you're making sure that it's getting into those channels that you just created. All right, in the next video, I'll show you how I do my scalp regenerative injections with the MP gun.